Acute porphyrias are characterized by symptoms and signs of damage to the nervous system and abdominal pain. Seizures develop over hours or days and may last for several weeks. Most carriers of the defective gene experience only a few or no seizures in their lifetime. Others have recurring symptoms. Hormonal factors play an important role. In women, seizures occur more often than in men, especially during periods of hormonal shifts. During the luteal phase of the menstrual cycle, when using oral contraceptives, in early pregnancy, or an early postpartum period. However, pregnancy is not contraindicated. Acute symptoms also include stool retention, a sharp increase in heart rate, an increase in blood pressure, and changes in urine color. The patient suffers from a decrease in sensitivity in the limbs, a feeling of bones and joint aches. There is muscle weakness. In severe cases, paralysis. Later, seizures, delusions, and hallucinations develop. A young girl, Alice, who suffers from intermittent porphyria, told how she lives and copes with her illness. She says there are different types. With cutaneous porphyria, people suffer from sun, rashes appear. Her porphyria is acute intermittent. If we can say so, it is the most common for this rare disease. It manifests itself in attacks, which means incessant pains. When these porphyrins in the blood increase due to any provoking factors, an attack occurs. In most cases, it begins with pain in the abdomen and lower back, then the whole body ache. Doctors blame some kind of appendicitis, want to cut open and look at the cause. Last summer, Alice had her first seizure. It happened while on vacation. It was a wonderful time. She and her husband walked a lot, rode electric scooters, saw the sights. When they returned home by train, Alice was constantly bothered by aching pain in her stomach. Then she could not even think that it was an attack. The ultrasound showed only a distended bowel. Alice turned to a gastroenterologist, whom she had been seeing for a long time, and then to a hematologist. They gave her glucose. The pain moved down. She was released home with the condition that if it got worse, she had to go back to the hospital. After that, she no longer remembers anything. Her husband said that Alice was in bed and refused to eat. It got worse after an hour. She was admitted to the hospital. She doesn't really remember these days. She didn't sleep, she didn't eat. She was in some kind of coma. In many patients, urine becomes bright red during attacks due to porphyrins. Alice read about a home test for porphyria. Leave the urine out in the sun for a day. If it turns red, then you're in trouble. The same happened to her mother. The scarlet color was either not noticed or they did not attach any importance to it. Her mom died a few years ago from an incomprehensible illness. Now doctors suspect that she suffered from porphyria. Alice probably inherited this disease. The girl notes that attacks are very dangerous. During her attack, doctors gave her 10 days before paralysis. During this time, the medication has to be administered, otherwise the nervous system can be severely affected. There are many stories published when the medicines were administered at the wrong time. Several people were paralyzed, and it took about 6 months to recover. After an attack, apathy and increased irritability are felt. A nervous attack out of the blue is a typical manifestation of the disease because it affects the nervous system. Many people take antidepressants, but you need to check all the pills that you're going to take because they can provoke an attack. There is a website where you can find out. This is a Bible for patients with porphyria. Alice has a little son. She gave birth to him before getting to know about her illness. Now she's worried about his health and is going to consult healthcare specialists about her son to find out if the child has inherited porphyria. Porphyria treatment is strictly individual. It includes hematotherapy, blood infusion through a drip, gene therapy, an attempt to eliminate or block a mutational gene, pharmacological therapy, and general stimulating therapy. To relieve an attack in acute porphyria, genetically modified blood is mainly used. That is, a preparation that contains blood components. These components are collected in an ampoule. It is administered at the time of an attack in a person with porphyria, and all symptoms disappear after 2 hours. The drug can only be administered through a catheter, which is placed in the neck under the collarbone. If, due to ignorance, the drug is injected into the arm, a blood clot may form. In fact, blood really saves a patient's life. Porphyria is dealt with in different ways. Non-severe attacks are managed with the introduction of glucose. Severe ones, with a transfusion of donor heme, or genetically modified blood. But there is no ready-made, clinically tested methods for a complete cure for this long-known disease. But there is an experimental one, and this is bone marrow transplantation. As soon as new hematopoietic cells take the place of old hematopoietic cells, they restart, among other things, the process of heme synthesis. At least 2 cases have been reported in scientific journals in which acute porphyria was treated with an unrelated hematopoietic cell transplant. However, medical specialists note that such treatment is very risky, and the benefits for the patient may be less than the potential harmful effects. The outcome of treatment can be affected by both the rejection reaction that occurs as a complication of transplantation and immunosuppression, which always precedes hematopoietic cell transplantation. 3 different therapeutic strategies are available: lowering the body's iron reserve, stimulating porphyrin clearance, and treating chronic hepatitis C, if present. These strategies may be combined for faster remission, although combining them is usually not necessary. However, there is another method for which the Nobel Prize in Chemistry was recently awarded. These are genetic scissors. With the help of genome editing, blood diseases are already being experimentally treated by planting modified hematopoietic cells in the patient, which begin to produce genetically healthy parts of the blood. True, this applies only to monogenic diseases, that is, those caused by damage to one gene. Science is not yet able to chase all the damaged genes with scissors. But porphyria is just one of them, and this means that Dracula, if he lived now, at least theoretically could be cured. Porphyria is diagnosed by a hematologist. The doctor examines the child or adult and includes all the symptoms that may indicate a violation in the process of heme synthesis in the anamnesis. The patient will have to answer questions about the medications taken, diet, past infectious diseases. The doctor asks female patients about the stability of the menstrual cycle, pregnancies, and abortions. The next step in the diagnosis is laboratory tests. The patient is assigned to study the concentration of enzymes in the blood and molecular genetic studies. If indicated, the patient sees a dermatologist, a nephrologist, and a gastroenterologist. Treatment of acute and erythropoietic porphyria requires hospitalization of the patient. Individuals suffering from cutaneous porphyria can be treated on an outpatient basis. Modern medicine does not have the means to completely eliminate disorders in the exchange of porphyrins. The efforts of doctors are aimed at eliminating the symptoms of the disease and the factors that provoke its exacerbation. Carriers of the acute porphyria gene should avoid potentially dangerous preparations, alcohol abuse, smoking, physical or emotional stress, fatigue, contact with organic solvents, for example when painting or dry cleaning, strict diets, fasting periods. The diet for obesity should be aimed at gradual weight loss and should be used only during periods of remission. Carriers of mixed porphyria should minimize sun exposure. UVB sunscreens are ineffective. It is better to use light-blocking creams with zinc oxide or titanium dioxide. Disease carriers should be clearly marked on medical records, or patients should wear a special medical warning badge with a list of necessary precautions. It is necessary to follow a strict diet, excluding all fatty, fried, smoked, spicy foods, and it is also necessary to completely stop drinking alcohol and smoking. A high carbohydrate diet reduces the risk of acute attacks. Some patients can manage moderate attacks by increasing their dextrose or glucose intake. However, in order to avoid obesity and dental caries, such a diet should not be followed for too long. So, let's sum it up. People with porphyria are, of course, not vampires. They do not attack people and do not drink blood. For the treatment of porphyria, genetically modified blood preparations are used to stop the exacerbation of the disease. Transmission of porphyria from a carrier to a healthy person is not possible. The disease is inherited by children from parents or acquired under the influence of risk factors. Carriers of the disease who plan to have children should visit a geneticist. Porphyria is an orphan disease that is not fully treatable. It is only possible to control the attacks, symptoms, and skin manifestations of the disease. A correct diagnosis in time is of critical importance. Under the right conditions and precautions, diet, while avoiding stress, sunlight, dangerous medicines, and chemicals, people with porphyria can lead a comfortable life and live happily ever after, although unfortunately not forever, like vampires from myths and legends. Always there for you, Dr. Popmed.